Okay, I'm going to run straight into our next speaker. We are running behind. Our next speaker is the amazing Ebele, and I'm going to read her bio for you. She is a registered dietitian
Yeah.
nutritionist. Sorry, if your mic is off, please mute it so that we can hear our speakers. So Ebella is a registered dietitian nutritionist dedicated to translating clinical evidence into actionable wellness tips for families. With a focus on pediatric and maternal nutrition, she empowers parents with clarity and knowledge to make informed dietary choices that improve health outcomes for both children and mothers. You see, we did not come to play today. We did not bring anyhow people for you guys. Please help me welcome Ebele to the call. And she is going to be talking to us today about managing food allergies and sensitivities in children, a dietitian's practical guide. Ebele, we are here and we are waiting for you. Please let us know if you are on the call.
Hello,
I can.
everyone.
Hey, welcome. The floor is yours. Please take it
Thank you
away.
so much. I'm so excited to be here, and I'm so glad to be meeting with you, ma'am, for the first time actually. So kudos to all Nutrition for Kids team. You are doing a super amazing work. Today, I will be speaking on the topic managing food um, allergies and sensitivities in children. Before I proceed, I would like every mom on this call to actually give yourself a beautiful round of applause
We have
because you are
daddies
into
here
great
too.
information.
Oh. We have some really good daddies here. Oh.
Oh, beautiful, amazing. Please give yourself a round of applause. And the reason why I'm saying that is because the topic I'm actually treating today has to be about you being aware, being food allergy aware, being food sensitivity aware, right? And if you aren't aware, there is no way you would be able to, should in case situations arise, you would, if the knowledge is not there, if the information is not there, you won't know the right thing to do, and you won't be able to manage the situation. So for you taking out time to actually come out to gain knowledge, I applaud you and give it to you. Well done, well done, well done. So without further ado, I'll be sharing my screen. Okay, so thank you so much for your patience. Please kindly confirm you can see my screen.
Yes, we can see your screen.
All right, thank you so much. Thank you so much. So today, as mentioned
Yes,
earlier, the
ma'am.
topic for me today is
Oh, sorry. Becky is asking if there's no volume. Please, can everybody hear her? Let us know. Just give us a thumbs up or clap your hands, a heart, so that we know that you can hear her.
Yes, yes, we can hear.
Great. All right. Continue. Thank you so much.
all right, thank you so much. So today I will be speaking on managing food allergies and sensitivities in children, and this is like a practical roadmap for families, right? Today, at the end of this session, you would be able to distinguish between what food allergy is, food sensitivity is. You'll be able to tell the difference because that's one of the major reasons why we are looking at this topic. And then you'll be able to describe the signs and symptoms of both conditions, identify common food allergies and intolerance, and then you'll be able to describe the management of both conditions. Food allergy and intolerance, right? So oftentimes we hear, oh, food allergy, we hear food intolerance. So the topic given to me is I was given food allergy and sensitivity, right? So for the purpose of this session, I would be using intolerance interchangeably with sensitivity. So for food allergy, um, I want us to paint a picture. A mom has breastfed her baby for good 6 months. She has taken her time to practice exclusive breastfeeding. Then she's so excited to start her child on complementary feeding. Suddenly, she realizes that after feeding her baby the first bowl, or yeah, let me say the first bowl of complementary food, then suddenly a child developed some reactions, and then she started seeing swollen lips, swollen face, and then she gets into, this kind of confusion. If you've if you pictured that, I want you to now bring it back to what food allergy is. Food allergy is an adverse immune response to a food protein following exposure, right? So the immune system is the body's defense system, right? Once we say, oh, there is food allergy, that means the person's body is mistaking the protein components of the food taken to be dangerous, right? And once this happens, the body reacts by releasing what we call antibodies that cause allergy symptoms. And it can be triggered by exposure, even at very, very little dose. At very, very little dose, allergic reactions can occur. So one thing I want you to actually hold on to regarding what food allergy is that the body has this adverse reaction to the protein component of food when eating, right? So for food intolerance happens when the body has difficulty digesting or metabolizing the food. So for allergy is reaction to the protein component of the food, while food intolerance is the simply just means that the body does not have a particular tool, let me use that word, tool, to break down the food eaten, that is to digest the food taken. And oftentimes it does not oftentimes it has to do with things like carbohydrate component of food. So here I gave an example. I said when a child lacks, for instance, when a child lacks lactase needed to handle milk, that is lactose in milk, the child we would say the child who has food intolerance. And for food intolerance, we have the enzyme deficiencies, we have the pharmacological we have reaction to pharmacological agents in food, and we have reaction to naturally occurring substances in food. I would get right into this very, very soon. And another thing we need to actually take note of is that food intolerance is non-immunological mediated. That is, it is not it has nothing to do with the immune system. Like, it's not an immune response. Taking note of these differences would actually help to save lives. And that is why it is very important to be able to tell the difference between allergy and intolerance. Truth be told, sometimes, not always, it is not always clear cut. But especially with intolerance, with more awareness and with more tracking, parents get to fully understand, what food intolerance is and the symptoms that children, exhibit when they experience food intolerance. This is an image to actually help us have a deeper understanding of what the difference between food allergy is and then what food intolerance is. Now, they are both reactions to food, right? They are both reactions to food. We have for food allergy, we have what we call the IgE mediated allergy and the non-IgE mediated allergy. Then we have food intolerance. Again, I would emphasize it is important to be aware of these differences because delay in actually recognizing some form of reactions could be really, really dangerous, right? And it could have adverse effects on the child experiencing the symptoms. So that is why it is really, really important for us to pay very close attention to, the differences between these um, food reactions. Now, when we talk about IgE mediated food allergy, usually the response is usually immediate. That is, a child consumes, take for instance, okay, in our climate year, even though I don't, in our climate year, we have a particular food that is very popular amongst moms when introducing their children to solids. I know if I should ask us to drop it in the comment section now, everybody would know the particular food I'm talking about, right?
Yeah, I
So
know.
I want to
But
start ma.
and then me, I know, but will not answer. You people should answer in the comments. Let's know whether all of us are doing the
Pap.
same.
Good, thank you so much. So once you ask any mom, oh, what are you starting your child on? You hear pap, or even some parents for the first 6 months, you keep hearing pap, 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 and you be like, oh my goodness, pap. Okay, so um, for pap, pap is good, pap is beautiful, pap is our local meal, pap is our and it's very versatile. You can actually get different recipes and even different nutrients for making use of pap, right? So this is not actually an attack on pap, but I think this is by the side just to say that should in case, although I know I'm even very convinced that nutrition for kids is doing an amazing job, right? And then mothers in the community enjoy variety of recipes. So it's just to say that yes, pap is beautiful, pap is lovely, but we also have a variety of meals that our babies can also enjoy. That's just by the way. So I was going to say something, right? That okay, so once you ask a mom, what are you starting your baby, what are you starting your child on? Solid sweet, you hear pap. So sometimes you might say, oh, I'm giving my baby pap with crayfish. That's a very common example at Mr. So let me use what is really, really familiar, right? And suddenly a mother introduces her child. I'll be using complementary feeding phase a lot, and that's because during the period of complementary feeding, mothers, that's the time a child is being exposed to more meals, much more than the child has been taking, especially from the flavorings sipping the child is getting from breast milk, right? So once a mother gives her child, oh, let's say pap with crayfish, right? And just within minutes, the child begins to, experience some reactions, and then there is swollen lips or even hives like itching and then wheezing or immediate reaction within minutes to 2 hours after eating, right? That is an IG mediated food allergy. And it is important to take note of the period of this reaction because once you know that this is a sudden onset reaction, you know that, oh, this could be really, really dangerous and life endangering, right? So the symptoms when it comes to this immediate reaction, IG mediated food allergy, there's immediate reaction, there's immediate symptoms like the hives, like the itching, swollen face, swollen eyelids, swollen lips. There could be vomiting, abdominal pain. There could be coughing, wheezing, throat tightness, and then the child is finding it difficult to breathe, dizziness, and then it could even get much more dangerous. Now, one thing I want us to realize is that for this particular for this particular IG mediated food allergy, you notice that it cuts across different body system. I've talked about wheezing, coughing, throat tightness, dizziness, reactions on the skin. That is, when it comes to these immediate reactions, it cuts across multiple systems, right? So once you see that, oh, there are multiple systems being involved in the reaction you are seeing, there is every possibility that that reaction is IgE mediated food allergy, and it's really, really, really dangerous. Now we also have the non-IgE mediated food allergy, right? This also has to do with the immune system. However, the onset is a little bit delayed, more delayed compared to the IgE mediated food allergy. And most of the symptoms are actually targeted towards the gastrointestinal system, which as highlighted here, you can see persistent vomiting, chronic diarrhea, blood or mucus in the stool, abdominal discomfort. And then when it comes to the child's reaction to it, like you begin to see poor weight gain because over time the child has been experiencing um nutrient gaps and the child has not been able to absorb enough nutrients, you begin to see poor weight gain, and then the child has lethargy. And in fact, sometimes this lethargy is even also very immediate. Like you see a child, you feed a child a particular kind of meal, and instantly the child is already developing and child is already developing some symptoms, and child is already looking very, very weak, right? So these are symptoms you want to actually um have at the back of your mind when it comes to food allergy. Now, when it comes to food intolerance, right? So, food intolerance is also, an adverse reaction to food, but it is not. I would say it is not as life threatening, even though it is life threatening, but it is not as life threatening as when it comes to food allergy, that within seconds, within the twinkle of an eye, things can just go haywire, right? So when it comes to food allergy and food intolerance, it's majorly targeted towards gastrointestinal system, right? So it's majorly targeted towards the digestive system. And then the child takes the food, the child experiences bloating, cramps, diarrhea, and sometimes the child experiences headaches and um, lightheadedness, and symptoms associated with having headaches and brain fog. Now, once a child consumes a food and you are realizing that, the onset is not like immediate, it's the reaction spans about maybe hours or even days before you start noticing reactions, that is food intolerance, right? And then this is majorly targeted towards the gastrointestinal system. So in summary, IgE reactions are rapid, like they are much more rapid, and they are much more life
Have
threatening.
about 5 more minutes before we have to ask questions.
Oh, wow, that's so fast.
It goes by very
Okay.
fast and you're passionate.
Okay. So, let me see how I can actually maximize my time going forward. So, thank you so much for that prompt, ma'am. So, for food intolerance, right? When it comes to food intolerance, I've mentioned that we have the child does not have particular enzymes to help break down certain components of the food. So take for instance, you've been hearing, a child is lactose intolerant. A lot of us have heard lactose intolerance. That means the child does not have, the child is deficient of lactase to help break down lactose. And then we also have examples like fructose as well. That is, the child cannot break down sugars in fruits and also some other complex carbohydrates. So these are some other examples of food intolerance. Now, when it comes to diagnosis of food intolerance, this is where the work actually begins, right? You want to actually be very, very mindful. So I said I will be making a lot of examples. I'll be referring a lot to complementary feeding, right? So at the period of complementary feeding, you are always excited. Oh, I'm entering into a new phase, I'm entering into a new period, and you are always eager to introduce something new to your baby, and you want to like rest from exclusive breastfeeding. You If you notice any symptom, you want to like track the symptoms, especially even if it is not like sudden, especially when it comes to food intolerance. You want to track the symptoms, because at the point of diagnosis, it is the symptoms, like the symptom history, you are able to give to us healthcare professionals, that would be able to bring together to be able to diagnose food intolerance. So for the management plan, let me just move to the management plan of food intolerance. You want to be able to identify the trigger. What is triggering this food intolerance? What is triggering this constant diarrhea in my child? You want to be mindful, you want to take note of it. Then you want to, by the time you are able to identify that trigger, you want to adjust your child's intake to that meal, right? So oftentimes food intolerance is actually dosage dependent, right? So you want to see, if you reduce, by the time you're able to identify the trigger, you're able to reduce the quantity of that particular food that is causing the issue to the child. Is there, you want to track your child's response to that adjustment. Now, very quickly, I'll move to common food allergens, right? So in the common food allergens that we have includes eggs, cow milk, fish, peanuts, tree nuts, sesame seeds, soy, shellfish, and wheat. This is just an image to show us what an allergic reaction looks like in a child, right? Um, I have a scenario here, but for time, I will just skip. I want to know if we actually got the difference between food allergy and food intolerance. So I would move to I'll move to food allergy diagnosis. So now, we've said that food allergy is actually really, 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 really life threatening. Now, there is this note of warning. If this is to make us aware, right? To be food allergy aware. And if you are noticing probably any kind of food allergy symptom in your child, it is not appropriate to self-diagnose food allergy, right? So, and it is not a guesswork. You don't guess, oh, my child is seeing this symptom, that means my child has this allergy. No, you have to like carry out a test to validate, and then we healthcare professionals will ask you some questions to get to get your child's medical history to be able to tell that yes, your child currently has certain food allergies, and there are some tests that will be carried out as seen on the screen to actually ascertain. So very quickly, I hope I will be able to maximize the few minutes left. I should be having like one more.
Have one more minute.
Yes, one more minute. Okay, so this is the roadmap I actually have for us for management of food allergy. So one thing that is very important with management of food allergy is that you want to avoid the trigger. Like you are paying close attention to your child, you are paying close attention to what your child is reacting to. For food allergy, we said that even the minutest, quantity being given to the child can actually, bring about life-threatening symptoms. So you want to avoid whatever the allergy is. Then you want to ensure that you are reading labels, and you want to learn how to read labels. Then you want to avoid cross-contamination when giving your child meals, and then you want to understand your child's reaction. Now my time is actually, I've exhausted my time, but then nutrition for kids, I would like to say that I think I'm not so sure we started exactly around 7:35.
No, no, no.
Am I right?
So we have time for questions. That's why I said, let me ask some of the
Okay.
questions. Yeah, we want
Okay.
to give people the opportunity to ask questions so that the
Ask.
questions might even be part of the 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 slides that you had. So
Okay.
someone asked, um,
Okay.
do children outgrow this and when? That's these food allergies or intolerances.
Okay, beautiful question. So, we have food allergies and we have food intolerances, right? So, the answer to the question is yes and no, because we have certain food allergies that it is very, very difficult for children to outgrow, and we have food allergies that children actually outgrow. So, I'll give us an example. When it comes to allergies like milk allergy, right? There are some children actually outgrow it, right? Especially when you don't just fold your hands and just wait. You have a food allergy plan to follow when you realize that, oh, my child has this allergy, right? For allergies like peanut allergies, it is very, very difficult for most children to actually outgrow peanut allergies, right? So the answer to the question is yes and no. For certain foods, yes, children can outgrow their allergies, but for certain ones, it is very, very rare for them to actually outgrow them. So the most important thing is that once you realize that your child has an allergy, work with your healthcare professional, dietitians, nutritionists, your pediatrician, to ensure that you have a plan, right? And to keep your child safe, and also to see if you can safely eliminate.
Okay. I have two more questions that we can take. Oh my goodness, I don't know if it is a network issue. But the first question is the rashes on baby's face a sign? I don't know if you can hear me. Oh. Sorry, please, can you guys let me know if you can hear me
We
or
can
maybe it's
hear
the
you.
Okay,
Yeah, we
okay.
can hear you.
Oh, okay. We lost her there just